Thank you, everyone. My name is Anubhav. Excited to be doing an amazing session. Care to scale or scale to care? The GTM playbook. That's what we're going to talk about. And as we discussed, let's just jump into it because we have a few minutes left. Let's go in that order. I want you to introduce yourself quickly, but after that, what is your business model? What is your ICP? And then a little bit something different. What's peculiar about you that people should know?
Thanks. Hello. Yeah. Thanks, Anubhav. Very nice to be here. I'm Ramakant, founder of Vyza. Vyza is a AI-based intervention for mental health. So we deliver a therapeutic intervention on an AI chatbot. Started 2017, so 5 years before ChatGPT. One of the largest in the world today. So about 1 billion conversations on the platform. 6 million people served, 14 million people covered across 100 countries. And we started life in 2017 as a B2C play. And then very quickly, COVID happened. We moved to B2B. So now our current model is mainly monetizing with insurers, employers, and institutional partners. Work with 10 insurance companies across the world. And also recently have started reimbursement in US healthcare. So that's kind of the business model. Made lots of mistakes, which I'll be very happy to talk about today.
Sure. And of course, something peculiar about you that people should know.
Yeah, well, I'm scared of snakes.
Okay. Thank you.
If you are not scared of snakes, you should say.
Yeah. See, I love snakes.
We need to talk.
Over to you, Alok.
I'm Alok, founder and CEO of Live Protect. We are building new industry segments and product categories out of India, largely engineering. We are in sustainability and health. Our key products are in water, healthcare, which is advanced materials, and in bioenergy. So we've embarked on a journey to take our innovations global. We are 4 years old. We've kind of building new product categories, like he said, made a lot of mistakes. I come from a corporate background. I spent 20 years in corporate life and 15 years being an entrepreneur. I think finally found my bearing wanting to build innovations. Prior to that, I've done early seed investments into companies and a few others in my journey. What we have learned is about what is the difference between taking new categories into market, especially engineering, which India is not known for. I think a lot of work has been done on software and many other areas, but we've not done engineering work and we're not known as a country. So we obviously had a lot of challenges and we've understood a lot of these things. Something peculiar about me.
Tough one, huh?
Yeah, it's a tough one, but I like my own company. I like to sit alone a lot.
Yeah. Okay. Thank you. Thanks a lot. Over to you, Kalyan.
Hi, everybody. Good afternoon. My name is Kalyan. I run a company called 5C, based in BTM Layout. We build products at the intersection of AI and medical imaging. My primary customers are hospitals and diagnostic centers, and we basically give them a AI-generated radiologist-validated report. Today, we read approximately 2% of all the scans that happen in India. And we also have the largest, 5C is today, the largest employer and the largest connector of radiologists in the country, very much up there in the top in the world. Like I said, my ICP are hospitals and diagnostic centers. Both we serve 5 of the top 10 hospitals in India today. We also work with 2,000 plus smaller hospitals and diagnostic centers across the country. We're in every state, in every district today.
Wow. Thank you.
Yep.
Thanks. And of course,
Something peculiar. Okay. Before I started 5C, I was a professional singer.
oh, okay. Wonderful. Thank you. People can reach out with that message there.
Absolutely. Hello, everyone. I'm Aditi Bhattacharya. I am the Vice President of Scientific Affairs at Ultrahuman. Ultrahuman is a 6-year-old startup that started in Bangalore, but now we have offices across UAE, UK, and the US. We are a wearables and passive health optimization company. Now, what does that mean? Basically, we have a platform of wearables and services. We have the Ultrahuman Ring, which is amongst the top 5 in the world. We have over 500,000 users across 105 countries, and we have a CGM. We were one of the first people to start a CGM in the wellness space way back before the COVID actually hit. And we have blood interaction reports as well as home environment sensing. all of these data streams come into one platform, and we actually provide personalized user insights. Something peculiar about me?
Yeah.
I try not to read non-fiction books. I'm very much a fiction
Okay.
bookworm, so you'll find my nose into a sci-fi novel more than anything else.
Thank you. And because I'm moderating, my love for contrasting socks that you can see me on is what peculiar about me. All right, so I think the intention for us is to help the audience understand what specific GTM strategies have you experimented with, what worked and didn't work. And given that all of you come from a very different background from B2B, B2B to C, B2B, pivoting, B2C, B2B. So I think we have a whole gamut of options for people. Anyone who want to get started, first and foremost, what's your current go-to-market strategy? What's working? And did you have any pivots while you were thinking about B2B, B2C, and how did that happen?
Okay, Anubhav, I'll take it the other way around. So first, I think it's more fun to talk about all the bloody noses we've got.
Okay.
So all the mistakes we've made. So
Sure.
just a quick note on where Wiser makes money. So about 70% of our revenue comes from the US. So we monetize amongst, and the three customer profiles are public health, insurance and insurers in a variety of ways, and employers.
Got it.
And so we work with not just the US, but then about 20% comes from the UK. So we are probably cover about 30% of the adult therapy platform or the adult therapy footprint in the NHS, in the National Health Service in the UK today. And the remaining 10% is what we broadly call international, which includes India. So, and I think the primary, probably the big, I'll draw lessons learned as well as mistakes made from both the US and the UK. So, we started monetizing in B2B, and this is probably addressed, this is actually addressed to all the founders out there who are also thinking about and saying, hey, the US is a huge market, $4 trillion in the healthcare industry, surely there's money to be made, right? That's kind of the operating principle. So before I start though, I do want to ask one question of the audience is, how many of you know what a CPT code is?
Okay.
Okay, not, how many of you plan to monetize in the US? Okay, so roughly about double the number, which is a problem because if you're monetizing in the US healthcare system, you need to know what a CPT code is because that's the primary reimbursement pathway.
Yeah.
I learned about it 3 or 4 years into Visa, which I think was a huge mistake. So my huge, I think, first counsel to everybody would be please find out what reimbursement pathways exist and work backwards from there. In terms of everything follows. You know, your GTM, your org structure, your product, what you want to do in PMF, what your clinical outcome strategy is will be determined by your GTM. And which will be determined by what the reimbursement pathway is. So I think that's kind of the overarching, I think, point I wanted to make. We tried, in terms of mistakes, so we tried 3 ways in which we tried to make money, mainly in the US. And there are various flavors of Visa which are sold to all the different customer segments I spoke about. But our first port of call in B2B, in enterprise sales, was employers saying, we will sell a wellness solution as a mental health intervention to large employers. One of our large employer successes actually is Accenture, so we serve them across 53 countries, 750,000 employees. So we said, we need to replicate and get a lot more Accentures into the stable. So we did what all our VC investors told us, and what all my entrepreneur friends told me, saying you have to create an inside sales team. And so, and as soon as we raised our Series B, that's the first thing we did. Was they said, you have money in the bank, go spend it. So that was kind of what happened, and we started creating a bank of people who started sending out cold emails, started doing lead magnets, the playbook, the SaaS playbook, which it didn't work. Did not work very quickly, and I think one of the big issues, so I'll probably frame this in 2 ways. One is the mistake we made in terms of one word to identify the mistake, and how we found out. The harder thing for a founder to find out is when is it not working, right? Because it is very hard for you to admit failure. It is very hard for you to actually realize that this is actually not working and then say, I'm going to stop and pull the plug. So I think the big issue here was ignorance, in the sense that we really didn't know whom we were selling to. We said we had a product, we had a hammer, we were going looking for a nail. And it's again a standard 101 mistake, saying that you're ramping up an inside sales team without knowing who your ICP is, who your ideal customer profile is. And we thought we knew, but we actually didn't.
Okay.
And it very quickly started showing up in the data, saying, your click-through rates or your open rates are very low. Like we were getting 5, 10%, 25% of people, 60% of people got it. Inbound leads were getting qualified out before proposal. Only 25% were making it to proposals. Out of that, win rates were 10%. So very quickly realized that the inside lead magnet kind of, and these are just, again, metrics we saw. Very happy to share these, and I'm hoping that you never get to see numbers like these in your life. But that, I think, is one very quickly, GTM 1, which didn't work. GTM 2 was feet on street. So create a huge sales force. We created a 15 people sales force in the US. Again, very, very expensive. We said, now we're going to go and sell to employers, but we're going to go through brokers.
Okay.
And broker channel, so you have people like Gallagher and Aon and Hewitt and people who actually influence large corporates to buy wellness solutions. We said, those are the people we're going to go and target. Everybody came and told us, saying the way to do it is you need to find people who are experienced in selling to brokers. And so we created a 14, 15 people team, burn of around $3, $4 million a year. And there, I think failure happened in 3 phases, right? Phase one was, it's fantastic. We need to invest before if you don't invest, you will not make money. Money makes money,
Yeah.
right? So money makes money. So you got to just pump it in, hire. So we went and hired. Then phase 2 is, it's taking time. We have a $15 million pipeline. It's taking time, but be patient. And phase 3 was, it's your fault. The product doesn't work. It sucks. The brand sucks. And by that time, things had turned bitter, and we actually parted ways with a lot of people. But I think the key mistake we made was greed. Saying that you set up and you invest huge amounts of money, hoping that it will flow through. So that was GTM number 2 and failure number 2. Failure number 3 was, again, KOL sales. A lot of people say healthcare sales are led by key opinion leaders, get a team of advisors who will then parachute you into the very top of a hospital system or some people are laughing, or at the board level and so on. The issue there is, and here the mistake we made was fear. Because
Tell us more,
fear in the sense the advisor usually is a very senior person, will come and saying, if you don't hire me, this is never going to work. And I'm the only person who can get you into the door, but for that you need to pay to play. So you need to give me either equity or you need to give me money. My big counsel to all the entrepreneurs out there is, be very stingy with equity and be very careful, only pay for results, not for action.
Got it.
Because it's very easy. It's very easy to just burn through cash. I think we burned through about $500,000 in advisory fees. And so that was number 3.
Got it.
So mistake number 3.
Sure.
And ultimately what worked was founders are the best salespeople. So now and not me, although I am a founder, but what we did was we acquired a company in January who was monetizing with US payers through a reimbursement pathway. I did learn about CPT codes way before that, and we bought the company in January, and we bought another company now. So we are probably one of the few healthcare companies in India who've done 2 acquisitions in US healthcare, and that is what is actually working because they have already solved the 0 to 1 problem, and now we are going 1 to 10.
Sure.
So
Thank
that's
you.
my story. Sorry, long
No,
introduction,
but that's okay. I think that was valuable for the audience. And founder always is a great salesperson. And I think both of you are in the B2B space, and you have an approach on feet on the field. You have a different approach from a product perspective. What seems to be working, not working in your case? Maybe you want to start with mistakes or wins, whatever works.
Sure. So again, the context is that we have to sell to hospitals. And the big
Right.
problem for hospitals is that either their radiology reports are completely not on time or inaccurate or both, right?
Okay.
And so essentially we need to go to a hospital and tell them that, hey, you have this problem and I will solve it for you. It's that simple. And so we tried a bunch of things, of course, in India. Today, like I said, we have mass coverage, but it took multiple iterations to get there. I can completely attest to what Ramakant said. Founder sales works. So the first 100 customers in 5C were onboarded directly by me and my co-founder Syed. So we just literally went out, literally, jute ghisna, they'll say, right? We
Right.
went door to door, customer to customer, and then convinced them of the product. And many of them will take a bet when they know that the boss,
Yeah.
it's not a big company, but the boss is, sitting there. And that helped. Then you have to scale, and of course you get advice. You get a lot of good advice. You get advice, and you'll get some money. So gluttony, greed, fear, all that happens. Stuff that didn't work. First, inside sales for Indian SME in general is very hard. Anybody who sold to Indian SME, forget hospitals.
Okay.
But inside sales to Indian SME is extremely difficult
Why?
because getting them on the call and convincing them that your product works on call just simply does not work. You cannot text them on, SMS is impossible in India. WhatsApp is also like a spam bot now. And so it's impossible to reach the Indian SME and convince the Indian SME to buy stuff remotely. I think even more so in healthcare where you need to show a little bit more seriousness. Number two, and this worked for a bit, we actually said, you know what, can we get dealers and distributors, right? Phones are sold like that. You have Reddingtons of the world where if you have a good product, you can kind of distribute them across. There is no Reddington for healthcare in India, unfortunately. There were a couple of guys of decent scale, but incentives for most of these guys are misaligned with incentives for new age software-based companies. So I charge customers for every case they send me, and I make a margin on that, and my margin is based on all the tech and capabilities that I have. Companies that distribute medical equipment in India distribute boxes. They know that they can sell one box a quarter, and after they sell that one box in the quarter, they're done, right? So it's much more lion mode, right? You can sleep, you can relax, but you need to get your one box in. We tried original equipment manufacturers. So
Okay.
there are big manufacturers of X-rays and CTs and MRIs, and they also carried our product. And it didn't work because, again, dumb guy that I am, they sell
you're
boxes.
not.
They sell boxes, right? They do not sell services. We tried to sell to each OEM guy has a big services arm. We tried to sell services to them, right? Did not work because the incentives were again misaligned. They have no reason to come and sell my service. We tried maybe a couple of years where my primary sales force was just channels. And then we finally said, listen, man, at least if I fail, let me fail on my own terms, where I can sell, and if I'm not able to sell, that's fine. But we realized that the business works at certain economics. So if my sales guy can close X number of customers, giving me Y number of cases, and broadly my margin will be that much, my break-even period is this. We got to a point where we understood that my sales break-even could be 4 months if I do it well, which essentially means that I have a financial instrument where if you put 1 rupee, right, technically you can get 3 rupees back at the end of the year. Would you invest in that? I would. It makes sense, right? And so it made absolute sense for us to then do feet on street. Of
Okay.
course, execution is everything. We started, it didn't work so well, blame goes around. Every problem is a sales problem.
Got
It could
it.
be a product problem, it could be a distribution problem, it could be a marketing problem, it could be a positioning problem. Everything shows up as a sales problem. So that was
And
an
I think
issue.
we should talk about how do you diagnose what problem to look at.
Yeah, because at some point in time you have to dig and say, does the product numbers look good? Is the positioning okay? As a founder, I have to go through that stack.
Sure.
But in the end, we realized that there is a framework that we have now built in 5C where we can get feet on street people in India, turbocharge and actually make them break even very quickly. And that has been very vital to our growth. So
Got it.
very contrary, there have been advisors, investors who would say, oh, you run a X number of people sales team. We have a 30-member sales team in 5C, right?
Got it.
You run such a big sales team, it's so difficult to manage people. Yeah, that's why this is a tough thing to do.
Got it.
And that's why there's an opportunity here.
Got
And
it.
so those are the lessons I've learned. So my takeaway would be, don't be scared of feet on street. If feet on street is a scary thing, it is a scary thing, hiring people, knowing that they're right. But it could be the right thing for you. So that is I would say that's a big
Sure.
takeaway from my
Thank you.
experience.
Before I come to Alok, I think one quick question maybe. I think you have a contrarian point of view about care to scale or scale to care, and you've had a very different experience coming from a program, development, and science background. Tell us more, how do you agree, disagree, or what's your point?
So I think one of the biggest disclaimers that I want to give here is I am not a founder. I advise founders and I help with all the scientific programs, the validations, etc. And of course, all the arguments which go back and forth with that. So I think one of the biggest things here is everyone keeps on thinking about it in terms of a very simple, minimum value product. This is what I have. this is what is my go-to market. That quite often is what on paper looks good. So one of the examples that I'd like to give is last year we actually provided one of the few heart rate variability, heart rate and temperature driven cycle prediction for women. And this was completely free, and we wanted to completely have this rolled out in all the countries that we had and all that. But the ones who were coming back to us were telling us that, can you give me a solution which doesn't work for textbook cycles? And that's exactly what we had done. That's exactly what we thought of all the amazing amount of training tech and all that which was there. And that's where we actually had to decide whether we want to pivot. We went and read papers. That is my job in life. And I thought that was all in papers, that only 13% of women have textbook cycles. 87% of women don't. And we were not building for that. And who was building for that? Literally no one, okay? And how much time would it take for us? It would take us possibly 3.5 years to do that. Because you would have to go through all the different types, you would have to go through clinical trials, you would have to go through a lot of those kinds of situations. And that's where we decided, what is it that we can do where we can provide the best amount of client-centric value for that. And we actually helped acquire a company, which is one of the only companies in the world which has 99% accuracy in ovulation prediction within a cycle. And that's something that we did, and we integrated. And immediately within the first month, we had more than 67,000 women who activated that.
Okay.
So sometimes it's not just about all the research that you've done, it's also all the feedback that you're getting, and also to sometimes pull that lever as to whether I can build that or somebody else already has that. And I think that's very important if you're trying to bring healthcare to scale. So from scale to care is that kind of a contrary view as well, and I think it's a cycle.
Cycle. Got it. And I think you have a different perspective from innovative products and maybe thinking product and category differently. What's your take?
Yeah. So we embarked on a journey where we said that we're going to build innovations out of India, not a Me Too product. So it's not every category, whether it's a tablet, mobile phones are getting done from outside. So we'll do engineering products and focus on sustainability in healthcare. As we were embarking on one of our product lines, we were thinking about COVID hit. So we are working on a bunch of scientists. So one of the scientists did have innovation which we licensed. The innovation got licensed to many people. We were the most successful in that. But we ended up calling it a COVID device. So when COVID disappeared, the device disappeared too from the market. Okay? So it's a great device, though it was controversial at that time. We had no bad feedback from the users. Only some press reports, and I think there are enough people who had vested interest to, it was money making at that time. But it could have been aerial biosafety. We did not have to call it a COVID device, okay? Because I think aerial biosafety, which all of us get viral fevers every now and then, institutions do. So we have great customers, and some of the customers are using for the last 3-4 years. They say the absenteeism has come down dramatically, okay? And we have individual use cases. But that device has no future right now. We may launch it again. Obviously, we had a lot of funnel, and we had licensed or bought technologies. So we had in water, bioenergy, and advanced materials. So one of the things we are doing is getting the category thing right, because people think of categories before. I think of buying a car, then I think of what kind of car, and then a subcategory via this thing, and then I will go into a model. Okay. Don't sell your product, figure out the category, and do that. So we are now doing a lot of work on category creation. Second thing, we figured out that customers are interested in talking to you, but may not necessarily buy, okay? And when you are an absolutely new innovation, early adopters are very critical. Your first 5, 10 customers, 15 customers, extremely critical. And everybody who talks to you does not. And everybody you think have a need, so this happened in our water business. We thought that there's a textile lobby, they were all going to close down, there were a lot of NGT cases on them. And if you just go to them and show them it works, they will buy. And we went and showed to them, most of the pilots worked, and none of them bought. They used the photographs, went to Pollution Control Board and wrote to them saying that give us another 1.5, 2 years because we're investing in new technology. Intent was not there, okay? And then we pivoted, and we went into multinationals, both Indian and global, which had clear mandate for sustainability. And now we have Saint Gobain, Tata's, Royal Enfield, many customers for our technologies. And that cost us 6 months, okay? And so our job now is to really figure out, is he truly an early adopter? Does he have a risk-taking capability? And what conversations is the customer having? Customer having conversations, where have you sold? And if he keeps on having risk-averse conversations, then he's not an early adopter. The risk people, the early adopters, 13% of the market, actually look at possibilities and what they can do and what they can look at. So if you are on a new area and you're trying to build a new product, think about customers and conversations very carefully. Most salespeople don't understand that well, and then therefore that's where the failure rates happen. And we had conversations on funnel, now we have conversation on early adopter. So I say, is he an early adopter? Prove to me he's an early adopter, and like to go and meet the customer. And if we latch onto the right early adopter where the decision maker is an early adopter, then we latch to a customer. If somebody junior is there, he may not be able to pull the plugs into an organization. So choosing your early customer is very important, and we are happy to say that at least now we have first year in which we might cross 100 crores, and it'll be clearly customers who are best in breed and early adopters. The third piece of the puzzle was what kind of product do you have? Do you have a very complex product or a simple product? We had complex. Finally, we had a great innovation, but it needed a whole plant to be set up. So you need a lot of, say, pre-treatment, post-treatment. In our advanced materials business, in healthcare, we need to integrate into various areas. When you go to partners, and I think that's what their learning is also, they will only go up to that limit because people listen to their customers. They don't listen to you. So if their customers are not talking about you, they are not going to do that. So pastors and distribution works on a model where they scale up an existing technology. They never build new technologies. So you have to do the whole product yourself. If it requires you to do things that will prove the first 20, 30 installations, you have to do it yourself. That's the next big learning. We lost nearly a year doing that in a water business, and now we've actually brought in everything internally. So we are kind of a unique company. We have 4 main divisions in an early stage company. We were not very lucky to raise a lot of money. We raised some money, but it was all structured debt. We have a great investor who helped us raise some structured debt. So we have very little money, most of them spent on buying the IP. So can't hire very high-end salespeople. So few of us are the sales organization. Within our organization, we are training people to kind of think about early adopters, think about will this customer buy or not, and focus on very few leads. So we focus on much lesser leads than we think for the first maybe 50, 100. But now we have some critical, once we learn something, there are some very interesting people who want to kind of do business development, and they are masters in business development, but you need to know the whole playbook yourself. And if you can show it to them, then they are helping us replicate. So we have a very interesting partner in the US. We have a very interesting partner south of India. He is taking us, our advanced materials right across defense and aerospace and space. We virtually are getting tested in all the labs today, and I think the orders will start flowing in, and we are passing with this thing test. So what we look at is what is the thing we lack, and is there somebody who's really motivated to do that? And we do a very detailed roles and responsibilities matrix in our company, which we say, I'm willing to do this, and what do I need from fulfillment? Will a partner do it? Is it real this thing? And then we create a program which is tailor-made to a partnering, which I can get people to do. But we realize that we did in the first 2.5 years, trying to sell, kind of trying to show them that they can do it and work with them. But now we understand we have to do it fully ourselves and then give them the playbook to scale. So,
got it. So when I'm hearing all of you, what I'm seeing is founder-led sales work, feet on street works, category first, and thinking about product and learnings and then going back. How is that different, let's say, if you're thinking about India versus global market? So we've even looked at outside India. Are there any insights which are very unique and different from thinking locally versus thinking globally, or specific market-related insights that you would like to share?
I think, one of the things about a consumer behavior, and that is very cultural, it's also dependent upon a lot of how much of the trends and how much of celebrity kind of positioning sometimes matters. So some of the experiences that we have had in India, let's just take one of our, our blood services. We thought that in India, where everybody is, every paisa ka hisab kind of thing, and we would basically be having the smaller running tests going, those were not the ones which actually sold much. It was the absolutely out of the thing, the early adopters, the best package which is there, tell me everything that I have. And that actually comes back to some of the earlier sessions before lunch, is that we don't have enough information on ourselves. And that happens because we don't have regular health checkups of that cadence. When we did the same kind of launch in the US, we thought that there it would be even more, like people, they want everything. No, the ones that they actually want there and the ones that are moving the needle are really the small types of tests. Because those are the ones that they need to do in order to keep current with their something. And driving 30 miles to get a blood test is a major pain. So just getting that HbA1c, which is required for their next doctor checkup, was more important to move the needle. So sometimes you go with some preconceived notions. You've thought that you've tested out everything in India, and the whole thing goes the other way.
I think my thought would be every health system is different. So whether you're talking India sale or you're talking India out sale or you're talking a US sale or a UK sale, you've got to really, really immerse yourself in the health system which you're selling in. And to do that, hiring the right people is key. And hiring insiders is key. I think people who know how that, as a founder, it's too expensive for you to go onto a learning curve saying, I'm going to learn everything which is there to learn about the NHS or the US healthcare system. You have to find people who actually know that, and from that point, then build out from there. I think that would be my one key topic, and goes back to, do you know what CPT codes are? You know.
I think I know we are running red on time. So my last thing, quick 10, 15 seconds. What is the number one piece of insight that you want people in the audience to know and they should take back and implement right away?
For me, if you're building feet on street, try not to buy a Salesforce or a Freshdesk. Today, the cost of code is basically the cost of token. You can literally build out your own workflows in sales. So don't do Freshdesk, don't do Salesforce. We are happy to show you our whole sales stack is completely built in-house and it works really well. And so don't get caught up in very big enterprise software. Like, go sell. Like, don't help somebody else sell, you sell.
I think mine would be, don't be scared of failure, because it's part of this territory. Just learn and recognize failure when it's happened. Don't take it personally and move on very quick. Thank you.
Yeah, I resonate with him. The biggest challenge for any entrepreneurs is accepting failure. And the most successful entrepreneurs, I think, accept failure faster and change their strategy and don't waste money. And I think sometimes if you have less resources, it's better. Okay, you waste less.
I think the only thing that I'd like to end with is that for every kind of thing is that have a very fast learning curve and bring in people who are experienced, because time is the biggest currency. It's not how much you're spending on different things. So having a talent-rich but experience-rich team and cross-functional important.
Perfect. Thank you, everyone. I hope this was valuable to all of you. You can all go and meet each one of them after this one-on-one. But thank you for your time. I hope you find it valuable. Take care.